Hi, I'm Stacey Allen, and I'm going to be presenting with my group on juvenile diabetes. Juvenile diabetes, or now known as type 1 diabetes in children, is when the child's pancreas no longer produces insulin. It is considered an autoimmune disease and has nothing to do with the child's diet and lifestyle. The immune system attacks and destroys insulin-producing cells. There are about 200,000 children living with type 1 diabetes right now, and it is estimated by 2050 there'll be about 600,000. There was a 21% increase in diagnosis in children between the years 2001 and 2009, and it is associated with an estimated loss of life expectancy of up to about 13 years. Although type 1 diabetes cannot be prevented, some scientists do think that breastfeeding can help prevent it, and although they're not sure what causes it, they think that it may be associated with a virus. Certain genes are associated with an increased risk, and also environmental factors. Although insulin is a treatment, it is not a cure. Some other risk factors are if there's a family history, such as another sibling having type 1 diabetes. Again, some specific genes are associated with a risk, and although type 1 diabetes can affect any age, there are two peaks in children's lives where it's noted to be higher, which is between 4 and 7 and 10 and 14. The symptoms of type 1 diabetes can occur quickly in a matter of weeks. There is an increased thirst and urination, increased hunger, fatigue, blurred vision, numbness or tingling in the hands and feet, sores that do not heal, and unexplained weight loss. The treatment for type 1 diabetes includes taking insulin on a regular basis, and there's many different types of ways to do that, where you do boluses or an insulin pump that continuously pumps insulin into the body, carb counting to maintain a healthy diet, frequent blood sugar monitoring, healthy eating, and regular exercise to maintain a healthy weight. Our patient scenario is Sarah M. is a 12-year-old girl with no known medical history who does not take any medications on a regular basis. Her mother has taken her to the doctor for symptoms of weight loss, increased thirst, frequent urination, and fatigue. It is noted at the doctor's office that she weighs 76 pounds, although last documented weight was 89. Blood pressure 95/70, temp normal at 98.1. After discussing the symptoms with the doctor, a blood glucose reading is taken from a finger stick and determined to be 366. The mother was advised to take the child directly to the emergency room. Some recommended guidelines for children with type 1 diabetes is the same day of the suspected diagnosis to make sure that they are referred to a multidisciplinary pediatric team to confirm the diagnosis and provide immediate treatment. Make sure that insulin regimes are individualized per patient. Encourage children to exercise on a regular basis to reduce the risk of cardiovascular disease later on. Advise children and family members to routinely perform at least 5 finger sticks for glucose tests per day, although more may be needed.
My name is Rebecca Barratt, and I'll be recording stage 1 of our case study. At the emergency room, a full workup was completed. Labs ordered included a CBC, CMP, and A1C. It's very important for us to get the A1C because we want to see what the patient's blood sugar has been like for the past 3 months. In this case, her A1C was high. It was 7.5%. Other results include blood pressure of 93/69, weight of 76 pounds, sodium 149, BUN 19, creatinine 0.7, and blood glucose of 378. Physician's orders. Sarah was admitted to the hospital with a diagnosis of juvenile diabetes, otherwise known as type 1 diabetes. She has become increasingly tired and now has some vomiting. The patient has made the following orders to stabilize the patient. We're going to do a urinalysis because we want to check for the presence of ketones in her urine. This happens when severe hyperglycemia is present. We're going to do insulin by IV to help decrease it at a quicker level. We're going to check her blood glucose every 4 hours per our guidelines. We're going to give her a low-carb diet. Studies have shown that foods high in carb, which is mostly processed foods, really peak the blood sugar and are not good for diabetics. We're going to give her an endocrinology consult. Newly diagnosed patients with type 1 diabetes can go through something called the honeymoon phase, where they respond very well to insulin and they can take very low doses. However, they quickly come out of that honeymoon phase and need to increase the levels of their insulin. So it's important that endocrinologists follow them to get their medication adjusted correctly. And we're going to give her a dietary consult so we can teach the family and the patient how to eat properly when being a diabetic. Physician assessment showed mild dehydration, type 1 diabetes, and ketonuria. So what are we as a nurse going to do? Some nursing interventions are administer the insulin per physician orders. We're going to encourage fluids since she's mildly dehydrated. We're going to monitor for signs and symptoms of hyper and hypoglycemia. We want to see how the insulin is affecting her. We're going to assist the patient with coping strategies. Hearing that you're a diabetic is very hard, especially for a younger person. So we're going to help her with that. And we're going to teach the patient and family, again, proper diet to help control the blood sugar levels. Some questions. How would you assess the effectiveness of insulin? Well, we're going to, again, reassess the blood sugar and see if the patient's symptoms have improved, such as her tiredness. Question 2. How many servings of fruits and vegetables should a child with type 1 diabetes consume in one day? Per our guidelines, children and young people with type 1 diabetes should eat at least 5 portions of fruits and vegetables every day.
Hi, my name is Ilha Alizada, and for the evidence-based project about the juvenile diabetes, I will be discussing about discharge planning. When the main thing that the patients need to remember about diabetes and discharge planning is that they always need to follow up with their primary care doctor. They have to make sure that if their blood sugar level is low or even high and it does not improve with treatment, that they need to go to a doctor to check that out. Also, if they have a fever or they have nausea and vomiting and cannot keep any food down, food or liquid down, they need to make sure to follow up with a primary care doctor. Some of the other signs and symptoms of diabetes that the patients need to make sure that they follow up with is if they have a blurred vision, double vision, or they have a breath that has a fruity, sweet smell to it, and if they have trouble thinking, sweating, or pounding heartbeat, they also need to make sure that they follow up with a primary care doctor. Some of the nursing interventions for juvenile diabetes patients is that they will need to take insulin each day. Insulin can be injected or given through an insulin pump, depending on the patient and their case. They need to make sure that they check their blood sugar levels before meals so that they can cover their insulin in a proper manner. If the blood glucose level of the patient is below 70, which is normal blood sugar level for patients is 80 through 130, they need to make sure that they have an access to eat or drink 15 grams of fast-acting carbohydrates. These are fast-acting carbohydrates are in fruits and dairy products. These patients also need to make sure that they check their feet regularly and wear shoes and socks that fit correctly. They should not trim their toenails at all, and they need to make sure that they can keep a healthy weight. These patients also need to make sure that they eat diet low in sodium, high in fiber, and that they need to limit their alcohol levels, because alcohol affects your blood sugar level and can make it harder to manage your diabetes. They need to exercise in order to make sure that they decrease their risk of heart disease and help them lose their weight. Patients who have diabetes, they have a high risk of serious illness if they get the flu, so they need to make sure that they ask their doctors about flu shots or pneumonia shots or hepatitis shots. They also need to make sure that they return to have their A1C checked every 3 months at least, and the healthcare provider will tell them what their A1C level that's correct for them. Not every patient's A1C level will be the same, and not every A1C level will be a correct one for each patient. These patients with diabetes, they will also need to make sure that they come back to visit their doctor and need their urine tests every year, and they need to make sure that they check their kidneys for any problems that may arise. Some of the questions that could be asked from patients who have diabetes is, well, why should the diabetics check their feet regularly? Well, the reason for that is because patients with diabetes usually suffer from neuropathy, which is a nerve damage, which will cause them have poor circulation and result in a slow down healing process, which will put their feet at a high risk for ulcers and infections because they will not know that they have it. Another question is why smoking is not recommended for patients with diabetes. The reason for that is because nicotine and other chemicals in cigarettes can cause damage and make it more difficult to manage their diabetes. Here's our references for our project. Thank you so much.
Hello, my name is Quanesha Simmons, and I'm going to be talking to you about stage 2 of Sarah's care. During this stage of treatment, the nurses will be responsible for continuing treatment to ensure that Sarah remains stable. She will continue the IV fluids to get her rehydrated, and her glucose levels will continue to be monitored as well, and her intake and output will be closely watched. By this point, IV insulin will no longer be required, so she will be receiving insulin therapy subcutaneously. The nurses will also continue to assess the effects of the diabetic therapy. Sarah and her mother will need to meet with the nursing educators or the dietitians for specific teaching in order to manage her care as she prepares for discharge. Some of the long-term complications of diabetes include heart and blood vessel damages, which can dramatically increase your risk for diseases such as heart attacks, stroke, and even high blood pressure. Neuropathy can cause tingling or numbness and burning pains, which may begin at the tip of your toes and fingers and gradually spread upwards. Kidney damages can occur, leading to kidney failure, which will require you to become on dialysis or even need a transplant. Diabetes can also damage your eyes, potentially leading to blindness and other serious conditions such as cataracts and glaucoma. Your foot can become damaged, causing poor circulation, and if you can't feel anything, it can lead to you having cuts and blisters, which can become seriously infected and will heal poorly and ultimately require you to have that area, your toe, your foot, or your leg amputated. Your skin and your mouth also leaves you susceptible to other bacterial and fungal infections. Some of the complications of pregnancy puts the mother at risk for miscarriages, stillbirth, and other birth defects. Question number 3. Let's put some of these areas in the proper category. Either early symptoms or late findings. We have excessive thirst, blindness, excessive urination, increased hunger, neuropathy, foot problems, skin conditions, vomiting, weight loss, and stroke. Some of the early symptoms include excessive thirst, excessive urination, increased hunger, vomiting, and weight loss. Some of the late complications include blindness, neuropathy, foot problems, skin conditions, and stroke. Question number 4. Long-term complications from diabetes can lead to the following. Select all that apply. A. Cancer. B. Neuropathy. C. Blindness. D. Obesity. And E. Stroke. The correct answers are B, C, and E.